Okay, so let's just take a moment to remind ourselves that we need to take time to read the guidelines for ourselves. Okay, I can read them to you from the PowerPoint. I can open my coding manual and read it to you. But you need to read the guidelines for yourself. That's something that's very important. And another thing you need to do is to think about what you read or meditate on what you read. Okay. And remember that repetition is the mother of retention. So the more you do something, the easier it is to remember it. We have lots and lots of guidelines. So, what's your strategy? How are you going to remember all this information if you never sit down and take the time to think about it? Hmm? What's the plan there? So, again, for emphasis, meditate on the things that we discuss on these videos. And what we see in the picture is someone who maybe was surfing, but look, he's stopping, he's taking time to think. Maybe he's thinking how he could have done a better job of catching the wave. Or maybe he's thinking about a problem. Maybe he's trying to remember some information he learned for class. So you can think in a lovely area, find a place where there is a good view. Maybe it's a little bit of flowers and some nice scenery. Sit down, think about the things you've been learning. When you think things through, it sticks with you. So we want to emphasize this throughout the program over and over again. So please make sure you meditate. Make sure you repeat things. Again, that's how you will retain them. All right, so today we're working on mental and behavioral health. Now, these are the Chapter 5 guidelines in the ICD-10 CM manual. So if you're familiar with guidelines, you can turn to Chapter 5 in whatever book you're using, and you will see these guidelines. Now, we want to first talk about the code F45.41. This code is for pain that is exclusively related to psychological disorders. Now, what you want to do is pause this video, take a moment, and go look at the code F45.41. And then you also want to take a moment and go to your code G89. Now, when you go to the category G89, what you want to do is pay attention to the excludes one note. And basically, that excludes one note is going to tell you that a code from category G89 should not be assigned with code F45.41. And we know excludes notes means that whatever is in the excludes cannot be coded with the main code. So you can check that out. And then we have an image here. You can see my directions. Please turn to G89. And then you will see that there is an excludes one note for generalized pain. And it also included F45.41. So again, very important to use your tabular section because it helps you to know what can and cannot be coded together, what should be coded first or used in addition to. So code F45.42 is now our focus. This is pain disorders with related psychological factors. This one should be used with a code from G89. Okay, so did that confuse you? Let's go back. Previously, we were talking about F45.41. This is not used with G89. Fast forward a bit, and we see that F45.42 should be used with a code from category G89. The importance of guidelines, right? Now, the next slide we're discussing um, the terms use, abuse, and dependence. So sometimes a provider will document and he may use use, abuse, and dependence of the same substance. So how do we code if he says the patient used and abused alcohol, which one do you code? Or if he says he used, abused, and depends on cannabis, what do you code? So we have a guideline on the hierarchy, and it says if both use and abuse are documented, then you're just coding abuse. If both abuse and dependence are documented, we only code the dependence. If use, abuse, and dependence are all documented, we only code for dependence. If both use and dependence are documented, assign only the code for dependence. So dependence is king. It overrules everything else. But it's good to know the hierarchy. Use and abuse, you code abuse. Abuse and dependence, code dependence. If it's use, abuse, and dependence, code dependence. If it's both use and dependence, we code dependence. Okay, so this is one you can meditate on. So when it is documented, this is a practice slide from AAPC. This is one of their questions for instructors to use. When it is documented that the patient is both using tobacco and has a dependence on the tobacco, how would you report it? Would you report using the tobacco, or would you report dependence on tobacco? Okay, the answer should be B. The documentation showed use and dependence, so only dependence is reported. All right, let's just try another practice slide here. We have the patient sees a 70-year-old, I'm sorry, the provider sees a 70-year-old patient with a documented history in the past few months of being combative and aggressive in the nursing home. So we're moving to some other things that you would see in behavioral health. The provider diagnoses the patient with dementia and refers the patient to a neurologist for further evaluation of her combative and aggressive behavior. So I'd like for you to pause the slide here, and after you get your answer, put me back on and we'll go to the next slide. Again, this is an AAPC practice question. So the answer is B, because this patient had dementia with an aggressive behavior, and that was all captured in one code. So your answer should have been B. Okay. Now, if you did not get B, I want you to look at what you chose and try to determine where you went wrong. And of course, this is what we're going to be doing in class. We want to talk about the things you don't get right. So we need to talk about it when you come to class. All right. Now, let's also discuss blood alcohol levels. So you could get the blood alcohol level from category Y90 in the back of the ICD-10 manual. You can check for Y90. And this code is basically for evidence that there's alcohol in blood involvement, and we can code the alcohol level. And you may also have to code from category F10 if there's some alcohol-related disorders. Now, the doctor does not have to be the one to document the blood alcohol level. If you have this information and it's provided to you in the medical record, it can be coded. So we have a syndrome here that I have the hardest time pronouncing. So what I'm going to do is show you the video for this particular syndrome, and then we're going to discuss it. And let me see if it'll play from here.
Munchausen by proxy, once an obscure medical term, is now taking center stage in the media. The story of Gypsy Rose Blanchard made national news. A mother accused of medically abusing her own daughter, faking diseases, confining her to a wheelchair. This real-life horror story inspired a documentary, TV series, and even got the attention of Dr. Phil.
Your mother kept you in a wheelchair. She kept you on a feeding tube.
She said I had muscular dystrophy.
You know now she was making all of that up.
She told me if I was to contact anybody and tell them, she would take a hammer to my fingers. I just didn't understand why my teeth were falling out.
You know now you didn't need to be in that wheelchair. You know now she was making all of that up.
My mother told the doctors that I couldn't eat, so they put a permanent feeding tube in. My mother told the doctors she's got the mind of like a child.
There's a good chance that this mother is making this child sick on purpose. You had a boyfriend. Did you ask him to kill your mother?
Yes. I wish I wouldn't have done any of that.
Gypsy Rose's story is real, yet still unbelievable. Dr. Judy, can you talk a little bit about what exactly Munchausen by proxy is, how common it might be?
So Munchausen by proxy is an illness where the person who's the perpetrator will try to impose an illness on another person, usually somebody that's in their care. And they can actually impose this illness by inducing symptoms or doing things to actually physically make the person sick, or they can just falsify things very dramatic in their presentation. And oftentimes it's very hard to know this because they switch doctors, they move. So it's hard to keep track of the medical records themselves. And I think a really important part of this is that we don't have good prevalence rates because people are not coming forward and saying, this is what I'm doing to my child. So what we guess though is that in hospital settings, it's probably about 1%. So it's not that uncommon, but it is somewhat rare.
You mentioned maybe a parent showing concern, but there are certain characteristics, maybe too much concern, maybe
That's right.
some red flags that these individuals exhibit.
Absolutely. So one of the red flags is that they're very dramatic in their presentation of the child or whoever they're taking care of their symptoms. They are very dramatic in the language that they use. They like to sort of be a medical marvel, some kind of medical mystery. Yes. And there is a very controlling aspect where they will not allow you access to the patient without them being present. And oftentimes they actually do come with some medical knowledge of their own. Either they've been very well studied, they're a graduate student, or maybe they're even in the medical profession somehow, because it makes it easier for them to falsify these symptoms in a way that kind of makes sense. But a huge telltale sign is when what they're saying just doesn't match up to the medical and diagnostic testing.
Okay, so this video came from the doctors, that TV show. And I hope you learned something about Munchausen syndrome by proxy. Basically, you saw that it's people making the patient sick or falsifying documents. So now we're going to look at how to code for that particular syndrome. Okay. So Munchausen syndrome by proxy, or MSBP, which I'm going to call it for my tongue's sake, is a disorder in which a caregiver, who is also called the perpetrator, falsely reports or causes an illness or injury in another person that would be the victim under his or her care. So the perpetrator in that case was the mother, and the victim was the daughter. And they give examples. It can be a child, it can be an elderly adult, or a person who has a disability. The condition is also referred to as factitious disorder imposed on another, or factitious disorder by proxy. The perpetrator, not the victim, receives the diagnosis. So again, we want to say the perpetrator, not the victim, receives this diagnosis. Our code would come from F68.A. Factitious disorder imposed on another to the perpetrator's record. The victim suffering from the MSBP will get a code from category T74, adult and child abuse, neglect, and other maltreatment confirmed, or we would use T76, adult and child abuse, neglect, and other maltreatment suspected. So again, we see the perpetrator would have the F68.A, the victim would have T74 or T76. So the factitious disorder imposed on self, or Munchausen syndrome, is a disorder in which a person falsely reports or causes his or her own physical or psychological signs or symptoms. For patients with documented factitious disorder on self or Munchausen syndrome, assign the appropriate code from subcategory F68.1. So what we see here are prefixes and suffixes related to behavioral health. And we have anxious, if you think of the term anxious, anxio, hallucino for hallucination, hypo, which you may be familiar with, under, below, decreased, or abnormally low. Manic, think of the term manic, excited, state, obsessive, mental, mind, para, abnormal, phobia, fear, psycho, mind, schizo, split. Feel free to pause the screen and review these terms because they will show up in the reading material for behavioral health. Next, you have ADD, attention deficit disorder. And then we have ADHD, attention deficit hyperactivity disorder. DT, delirium tremens. MDD could be major depressive disorder or manic depressive disorder. OCD, obsessive compulsive disorder. PTSD, post-traumatic stress disorder. SAD, seasonal affective disorder, or schizoaffective disorder. So you can pause here and look over these terms as well. You know, what can I say? It's a lot of information, right? But again, we always want to encourage you to meditate on the things that you learn, to think about it. How will you use this information in the future? What does it have to do with you? Will you even work in behavioral health? Do you know where you'll work at right now? You don't. So this is why you want to pay attention to what you're learning and also pay attention to how you're learning. You never know what your pathway or your journey will be like. So make sure you review this material, think about it, and I'll see you in our next video.